Welcome back, everyone. Dr. Darlene Weyer is with us today. She handles diagnostic radiology at Lima Memorial. We're talking a little bit about 3D mammography, especially at the hospital unit there in Wapak. First of all, tell us about the setup there. What kind of equipment do you have and what you can do for patients?
Yes, we have a new facility in Wapak at Lima Memorial Health Center, their medical center. And we now have the availability to do 3D mammography, which is state-of-the-art technology. Right there in Wapak for our patients. And the nice thing about 3D mammography is that in order to be able to see the breast tissue, we take anywhere from 50 to 100 images per breast versus the old technology, which we only took 2 images per breast. So now we're better able to see the teeny tiny cancers that may be hidden or obscured by the glandular tissue. And we have that technology right in the backyard for the patients who live right there in Wapak.
Yeah, so convenient for them. Give us a sense, again, we've talked about this in the past, but maybe who is kind of eligible for that? Who should start thinking about mammography and ages and that kind of thing?
We start yearly mammograms at the age of 40. And at the age of 40, every patient should have a mammogram every single year. They should never skip. Because if we're able to catch the cancer when it's very small, it's very treatable and the prognosis is much better. And patients who have a very strong family history of breast cancer, let's say they have a mother or a sister who was diagnosed with breast cancer, let's say at the age of 42, then that patient should start 10 years earlier than 42 having their mammogram. So let's say at the age of 32, they should have a mammogram every year moving forward.
And they can do that too, as you said, that 3D mammography technology is available. For those who maybe have never had a screening, this is a new thing for them, kind of walk us through it. What can they expect?
It's about a 15-minute exam. There is no pain. We put the breast in slight compression to obtain our images, and they're not in compression very long, just a few seconds, just long enough for our camera to take its image. The environment here at the medical park and also at our Wapak Center it's a very comfortable environment. It's not intimidating. It's not threatening. Our techs are excellent at what they do, and they are very conscientious in order to obtain great images, but at the same time, providing the patient comfort while doing their exam.
Yeah, you guys do a great job there. For in between the yearly mammograms, is there anything that the patients can do to protect themselves against breast cancer?
Yes, they can do monthly self-breast exams. And what we encourage women to do is do it in the shower when your hands are lathered up with soap, because your hands glide much more smoothly over the breast tissue. Women are typically the first person to notice any changes in the breast because they see the breast every day. And so if they develop a lump or nipple discharge, any skin changes, any abnormality in their breast that they have not noticed the month prior, they should bring it to their physician's attention, at which time we can do a mammogram if that's what's needed.
If someone's interested in that and they want to get a mammogram, start that yearly cycle, then what's the best way to do that? Give you guys a call?
Yes, they can give us a call at 419-998-4497. And that same phone number, they will be able to schedule a mammogram either at the medical park on East Town Road or our center in Wapak, whichever is closer for them. We provide the same technology at both facilities. So whatever's easier or closer for the patient, that's where they can have their mammogram done. And the important thing to know is that they do not need a script from their doctor. If they have not had a mammogram in the last year, they can call that number and schedule their mammogram. They do not need a doctor slip.
All right, technology is state of the art and so convenient. Dr. Weyer, thank you so much for telling us about it.
You're welcome. Thank you.
You bet. Nice chatting with you. We'll be back right after this.